Us now is Republican Senator John Barrasso from Wyoming. We also have former Health and Human Services Secretary Donna Shalala. Thanks to both of you for joining us. Senator, let me start with you. I mean, in the aftermath last night, the thing that I heard over and over again was that the problem was not enough is being done on health care, that the public option isn't in there, that the plan didn't go far enough. Do you agree with that?
No, I don't agree with that. The message out of Massachusetts last night, number one, is congratulations to Scott Brown. The people of Massachusetts know what health care reform has done in their state. It's caused the price of premiums to go up, what they have to pay. It caused cuts in services because it's been so expensive, and it's caused health care to actually get worse in Massachusetts. The people of Massachusetts get it right. They are tired of what's happening in Washington. They're tired of being shut out of the process. They're tired of a president who promises openness and transparency and then just goes behind closed deals and goes behind closed doors to cut deals and then to do payoffs and buy votes, as he's done in Nebraska and in Louisiana and in Florida with all of these giveaways just to get people to sign on to a bill that raises taxes, cuts Medicare for our seniors who depend on Medicare. It's going to cost $1 trillion and cause people's policies to go up.
Ms. Shalala, just to follow up on that, I mean, a lot of this race was also about the tax hike component. I mean, Scott Brown said cap and trade is a tax hike. The health care bill is a tax hike. He's sort of formulating kitchen table populism or pickup truck populism or Tea Party populism. Has your party missed the boat on this? Have the Democrats now moved way too far left, away from center ground?
I don't think so, but obviously the party has to sit back and take a very close look at what the people of Massachusetts were saying. What they were not saying, and here's where I disagree with the senator, is that they don't like the health care plan that they put together in Massachusetts, which is essentially the outline of the Senate plan. In fact, the vast majority of people in Massachusetts like what they did in Massachusetts, and the new senator supports that bill and does not support the repeal of the Massachusetts plan, which has massive federal subsidies in it, and is in fact the outline for what the Senate did.
Senator, what do you think about that? I mean, would that be the plan?
And let me add to that, Senator. What Scott Brown said about it last night in his acceptance speech was that it's double counting, that they've already got some of this in the Massachusetts plan on a smaller scale, and that they don't want to pay for the bigger plan coming out of Washington. Is that a fair criticism?
Well, you know, when the president went to Massachusetts, Larry, he didn't even directly mention his health care bill because he knew from the polling that anybody that said that Scott Brown was going to actually fight against the health care bill in Washington, they were more likely to vote for Scott Brown, and he mentioned that he was going to be the 41st vote. So I am not convinced that the people of Massachusetts want this health care bill, but they are very disappointed and disgusted with the direction that Washington has these closed-door meetings, everything done behind closed doors, and we need openness. And I think it's time now for the Democrats to, like that old telephone commercial, you know, do you hear me now? It is time for the folks to listen to what the American people are saying. You know, you're spending irresponsibly. You ought to be focusing on the economy. We have 10% unemployment. This should be about jobs, not about a health care plan, which is very expensive and is going to cause people to lose what they have right now.
Secretary Shalala, respond to that.
I absolutely disagree that people are going to lose what they have now. In fact, that's the essence of the bill. Most of this money is spent on expanding health care to those who don't currently have health care. There are millions of Americans that don't have access to health care. If you look at the Senate bill, the states develop the exchanges as they did in Massachusetts. The federal government substitutes individuals who cannot afford to buy that health insurance.
So why
That's exactly what happened in Massachusetts.
Why does it seem to be so unpopular? How can Democrats change it?
Only one in three Americans support the health care bill.
Which the senator objects to, which is not unusual, by the way. When the Republicans proposed the pharmaceutical benefit, a very large number of Americans were really skeptical about it. A year later, they wouldn't let anyone touch that pharmaceutical bill that passed. It is complex. There is no question that this health care bill is mostly focused on covering those that are uninsured. It was such an open process that it probably confused a lot of people. Months of open meetings with Republicans on the Senate side and the Senate Finance Committee trying to get agreement.
With all respect, I think that the backroom deals, the failure to put C-SPAN to let the public know what's going on was an absolute killer to this. And I want to ask Senator Barrasso, is there a way out? For example, there is a hardcore, chronically uninsured group for poverty reasons. Why not just use a simple thing like tax credits for them? And why not use a simple thing for competition and cost control like interstate insurance? In other words, is there a way to play small ball and have a much more downsized, less big government, less tax and less spend approach to health care? Is it possible that Scott Brown's election would trigger a complete re-look at this whole bill?
Well, I sure hope so, Larry, because as you know, I practiced medicine for 25 years in Wyoming, and we need health care reform. We need to do the things that are going to get the cost under control, help people that really need help, and I think that's what we want. We want people to have the same choices that members of the Senate and Congress have, and additionally, you want to help those people who really do need our help. But I don't think a huge expansion and a government takeover of health care, 1/6 of our economy, something that affects every person in this country so personally, is the way to go. And as the Secretary said, it's to cover more people, 18 million of whom will be put on Medicaid, a program that doesn't work right now because half of the doctors in the country won't see Medicaid patients because it pays so poorly. And yet to do it, they're going to hurt our seniors who depend upon Medicare by cutting Medicare by $500 billion, not to save Medicare, but to start a whole new government program, Larry.
Well, is it, Ms. Shalala, look, just
two things, Larry. Two things, yes. Please, Larry. Two things. Number one, the so-called cuts in Medicare are extra spending that's unnecessary. It's wasteful spending that a bipartisan commission, Republicans and Democrats, pretty much agree that we're overpaying the Medicare Advantage plans by at least 10%.
But isn't it double counting?
If the Republicans are opposed to eliminate excess spending,
isn't it double counting, though, Ms. Shalala? Isn't that one of the issues here? They're scoring it against Medicare, and then they're scoring it against the overall bill. I agree with you, ma'am, that Medicare is going broke.
Yeah, there's no question, but that's recognized. Yes, that's recognized. And tax credits, with all due respect, the Republicans proposed them. They couldn't even get the majority of their own party because people recognize that you cannot get coverage with tax credits.
Okay, we got to go.
You just don't get the coverage.
They're spending the same money twice.
We can't do it anymore.
They're
Sorry,
spending
guys,
the
we're out
same
of
money
time.
twice.
Thanks to both of you for joining us. We really appreciate it.
Thank you.
Thank you.
Thank you.